it's easy to point fingers at other people, but as researchers, we also have to think about the accessibility barriers that we keep in our research environments and in our research methods. And we at Open, we support, we want to emphasize the responsibility of researchers to think about how they can remove those unfair barriers. And that's what we would like to discuss with you today and illustrate with a few tips and examples. So first of all, to situate our conversation, we would like to give you a quick definition of what we mean by cognitive disability. We recognize that it is a poorly defined concept. We recently conducted a literature review looking at how the terms cognitive disability, impairment, and limitations are used in the literature. And it's obvious that there is no definition that is being consistently used. So we propose to think about cognitive disability as a situation of disadvantage that is experienced by individuals with cognitive abilities that differ from what is considered typical in one or more of the following domains: attention, executive functions, learning and memory, language, perceptual motor skills, or social cognitions. And of course, people with cognitive disability constitute a heterogeneous group with a range of coexisting strengths and limitations that often evolve over time and can be persistent, episodic, or temporary. We often think about specific diagnoses that are associated or often associated with cognitive difficulties. So of course, persons with cognitive disability, this group would include persons who live with dementia, with intellectual and developmental disability, people who self-identify as being autistic, who have attention deficit disorder, learning disabilities. But that list is way too long to use as a definition. It's more precise to use the functional definition I just presented, because there are hundreds of conditions that may be associated with cognitive difficulties. Et en français, le terme serait handicap cognitif. So now that we know who we are talking about, this group is a significant group in the population. Of course, because the definition is vague, it's difficult to determine the prevalence rates. But research tends to estimate that in the adult population, 1 in 10 persons would live with cognitive disability, with a prevalence that would increase in older age groups, and with the prevalence reaching 1 in 25 in older age groups. And so these individuals are already among our research participants and our co-researchers and collaborators. And it is important that we find ways to decrease the unfair barriers they may face when participating to research. That is how I finish the introduction of our talk, and I will let Munazza dive into the topic of inclusive research.
Thank you, Virginie. Thank you all for being here today. I'll start with a definition of inclusive research. Unlike cognitive disability, there is somewhat of a definition that exists of inclusive research that's been presented in the literature. We can think of inclusive research, as sort of or reframing the way in which we may ask research questions or think about research. So think of a person whose hands may work differently, and they're trying to open a can of beans. And traditionally, a researcher might ask, why can't that person open the can of beans? Or how can we help that person open that can of beans? In doing inclusive research, our goal is to reframe how we might ask that question. So for example, we might ask, why is the can of bean designed in a way that some people can't open it? Or how can we design this can of beans in a way that everyone can open it? So inclusive research, you may have heard other terms for a similar type of research like participatory research, emancipatory research. All of these types of research have the following elements in common. So inclusive research draws on lived experience to inform research processes and outcomes, and it's based on issues that are important to a certain group. So in this case, we're talking about persons with cognitive disabilities. Inclusive research also recognizes and values the contributions of the people that they're doing research with. And the recognition of that contribution can look different. It can be public recognition, it can be fair compensation, and we'll talk a little bit about those pieces as well. And lastly, inclusive research is meant to inspire social change. So all stakeholders involved in inclusive research are standing with the people whose issues are being explored or investigated. So some of the general considerations, when planning for inclusive research are, why should we think about persons with cognitive disabilities when we do research? Why would they join our research? Like, what's in it for them? That's an important question to ask. And what is meaningful to persons with cognitive disabilities, and how can we find out? So I have a video to show you from one of our advisors with her consent about why she thinks it's important for persons with cognitive disabilities to be included in research.
My name is Mary Beth Whiteson, and I'm 57 years old, and I was diagnosed with probable frontotemporal dementia about 10 years ago at the age of 46. And I immediately realized that I needed to do advocacy for myself and for others who also had dementia. And as I became informed on dementia research, it was quite apparent that there was a lack of lived experience voices working with researchers. And since that time, part of my advocacy work includes combining my efforts for change by working directly with researchers to realize the value of the voice of lived experience. Now, historically, people with dementia are either not included or they're underrepresented during that research part. And in many cases, organizations and care partners will speak for the person with dementia and with little consultation. Now, although their intentions are good, they're basically denying us that opportunity to have our voice heard. And so you may be asking that question, why? Why is it important to include me in your research? And simply put, involving people with lived experience in research is essential for actually a number of different reasons. So first, and the most important, I think, is that it helps to ensure that research is meaningful and to the population that it serves. So in my case, people with dementia, it doesn't matter what research you are, but it does matter to the population that you're serving to bubble up and make sure that it's their priority list. It creates useful research in that it makes a difference. So one of the challenges, I think, is that research people are always looking for things to research, but is it the right priority for that population? So it's only useful if it's meaningful to that population. And that's why working alongside people with relevant personal experience is essential to research. So by listening and learning for people with, from people with lived experience, you're more likely to create research that makes that difference. So finally, it is an ethically and scientifically essential component of health research. And authentic engagement means involving patients, members of the public, or organizations, and representing them as full partners or collaborators. So I want to use myself for a quick example. Open collaboration for cognitive accessibility asked me to provide some feedback on a voice payment system. The researcher took me through several different scenarios with the purpose of making it more cognitively accessible. So with that goal in mind, my key feedback centered around my inability to retain information from the previous screens that was presented to me. Some of the choice of words that the researcher was using to direct or ask questions, and even the speaking pace of the taped voice that was directing me needed some feedback from me. And if the voice system had gone live without receiving this feedback, but not just receiving it, but actually doing something with it, then people with cognitive issues like me may choose not to even use the system because it's frustrating and we may not understand necessarily what we're supposed to do.
That was one of our advisors who is frequently involved in research projects with us, accessibility testing projects, and does a lot of advocacy and speaks on research rights of persons with cognitive disabilities. In thinking of sort of the parts of research as you're planning to be inclusive, it's important to break down the research process into specific stages so that you can plan exactly what the inclusion of persons with cognitive disabilities will look like. Just a note on language here, Mary Beth mentioned, partners or collaborators in research. At Open, in our research team, we use the term advisors. And in the literature, you'll find the term co-researchers as well. So we sometimes use those terms interchangeably, but most often I might say co-researcher or advisor when we're talking about inclusive research specifically. So breaking the research process down into its stages so that you can envision how they can co-researchers can truly contribute to your project, not in a tokenistic way, but in a way that will be valuable to your research and to them. So remember, you don't have to do everything in one research study or be inclusive at every stage, but it's best to be systematic about it and consider each stage as a distinct opportunity to be inclusive. For example, you might consider being inclusive at the research question development stage, and they can help a co-researcher can help to inform your research question. You may choose to involve them in data collection. Maybe you're conducting interviews, and it may be helpful to have a person with lived experience conduct interviews with you because they may connect more closely with the people that you are interviewing. Or you might choose to do it at multiple stages, not every single one, but the stages where it makes sense for you and offer the most value to you and to the co-researcher and how they view themselves being included and valued. So some important questions to ask as you're making decisions about what stages of research to be inclusive. The first one to ask is who will be included. So identifying the individuals that will be included as co-researchers is the first crucial step. So this decision should take into account diverse perspectives. Maybe you're thinking that you need representation across, different demographics, or maybe you're looking for a specific demographic. So you're looking at things like age, gender, geographical area, type of lived experience that they have, or the level of support needs that they might have. Those are some things to consider as you ask who will be included. The next is why will they be included? Clearly defining the purpose of including co-researchers is the foundation for meaningful research collaboration. Are you looking to include them for their lived experience and expertise, or would it be more valuable for them and for you to have them participate in or conduct interviews because they might connect more with participants? So articulating those specific reasons is essential in your inclusive research planning. The next question we can ask is, when will they be included? Going back to the stages of research. Understanding when their input would be most critical and valuable should be part of your research plan. And then how will they be included? So planning for the methods and mechanisms for including co-researchers will help you design your research and explain your context. So this includes regular meetings, workshops, and other collaborative ways to facilitate communication with your co-researchers and account for accessibility accommodations when planning for how your co-researchers will be involved. Because when working with persons with cognitive disabilities, one of the most critical things to keep in mind will be accessibility, which we will discuss. Virginie previously mentioned physical accessibility barriers that were obvious. Sometimes those barriers are more visible, but cognitive accessibility barriers are just as prevalent, if not more, and affect a lot of people in our society. Some examples of cognitive accessibility barriers could be, websites or mobile apps that are visually cluttered and use inaccessible language. It could be forms or instructions, for example, for a medical device, forms that are difficult to understand and use very complex language. And same thing with research tools and measures that can include, inaccessible language. So an example of that is the NASA Task Load Index, which is commonly used for accessibility testing. It's provided to users who are testing technology. And one of the questions it asks is, how insecure, discouraged, irritated, stressed, and annoyed were you during the process of using this technology? And I'm sure many of you may feel that too. Like, what's the question here? They're asking for 5 different things, but it's one question. So that's an example of how tools and language can create those cognitive accessibility barriers. Another common barrier, if you can think about it, because a lot of us, I think, can relate to this, is completing math questions or math problems. Many of us can complete math problems if given sufficient time and given the tools to do so. But even if it's not a complex problem, a multiplication problem, but you have 10 seconds to do it and you can't use a calculator, it suddenly becomes very difficult. So that's another example of how you might end up in that situation where, it's sort of a cognitive barrier. So cognitive accessibility is making the environment easy to use, regardless of the way people think, learn, speak, or memorize. So this goes back to those functional domains that Virginie had mentioned earlier, as we think of the definition of cognitive disability. And building cognitive ramps for accessibility is essential. So ramps are a universal sort of symbol for accessibility. And when we think of cognitive ramps, we're thinking of, things like accessible language, which is one of the most instrumental and important cognitive ramps in research. So some tips for cognitive accessibility as you plan for inclusive research. Plan for the time that is required to build trusting relationships. Building relationships takes time, and it's important to allocate sufficient time for your co-researchers with cognitive disabilities to be comfortable and confident in their interactions with the research team. Prioritizing relationship building in the beginning will help to foster communication later on and lead to more meaningful research involvement from them. Plan for fair compensation of co-researchers in your budget. So they're bringing their expertise of lived experience, and to recognize their contribution, researchers should plan for that as they create their budget lines. Slow down and allow time for processing. It's important to be mindful of, different processing speeds. People can take different amounts of time to absorb information, process questions, and articulate their thoughts. And it's important to account for that time as you plan for your project. The length of commitment can also vary. So if you're expecting a long-term commitment from a co-researcher, it should be articulated at the beginning of that contract or that relationship. Changing skills is also important to keep in mind, because depending on the group that you're working with, for example, working with persons with dementia, they may have different cognitive accessibility barriers at the beginning of a project than they have later on in the project, or it might fluctuate. Cognitive needs may fluctuate. So that's important to keep in mind. You can also gather information about this, when you are conducting meetings, those initial meetings to get to know your co-researchers. You can determine some of their individual needs in that way, or if they give you consent, gather information from caregivers, family members, or support people who might be working with them to help them communicate or facilitate communication. Also think about transportation. Can they travel to the location you expect them to go to, or are there barriers such as, not being able to take public transportation or having problems with wayfinding? Can you meet them where they are at? It's always best to do meetings with persons with cognitive disabilities in places that are familiar to them. And then lastly, and arguably the most important, plan to create all research tools in accessible language. So this can mean following plain language guidelines that are published by Government of Canada, or going a step further and creating your tools in easy read, which is formulated specifically for persons with intellectual and developmental disabilities and presents in visual and textual information in accessible ways. So we'll move into the ethics portion. I know someone had a question about that. Before we go into this, I wanted to note that we've talked about co-researchers so far, co-researchers with cognitive disabilities, but these ethics challenges, especially with the issue of informed consent, is applicable to participants with cognitive disabilities as well, who might be participating in your research, even if you're not doing an inclusive study. So here I'll hand it over to Virginie for this slide.
So informed consent is just one of the ethics challenges that are relevant when involving persons with cognitive disabilities in research. It's never a good excuse to exclude them from research. It's not because it's difficult or we have challenges that we should decide to exclude them. It is our responsibility and our role to actually get the right resources and tools and training to be able to remove as many barriers as possible. When thinking about consent, there is an approach that is used by many researchers, especially in the medical field, where researchers would assess the capacity to consent of the individuals to determine whether or not they are capable of consenting to research. We are many researchers and advocates urging researchers to change their perspective and consider consent as an autonomy, as a basic human right. So the United Nations Convention for the Rights of Persons with Disabilities, which Canada ratified in 2010, reaffirmed that persons with disabilities possess the right to exercise autonomy across all domains of their life, and that includes research. And it also clearly states that it is our responsibility, our common responsibility, to provide persons with disabilities the tools and supports necessary to support sound decision-making. And so researchers must try to follow this human rights principle and conceptualize capacity to consent and to discourage the use of standardized capacity measures that are used as a cutoff score to determine whether or not people can consent to research. There are other approaches and there are tools that are available to help researchers determine if someone is able to consent to a research, to a specific research project. And when submitting REB applications, usually REBs will, research ethics boards, sorry, that was an acronym. Research ethics boards will want to know how you make sure that you provide information in a way that people will understand, how you will make sure that they actually understood their rights as a research participant or co-researcher, whatever their role is in the research, and what are you going to put in place to provide that information in an accessible way. So what we would like to do with the remaining slides is give you a few tips of how to proceed and how to conceptualize informed consent as a human right.
I was just going to mention in regard to acronyms, as researchers, it's a constant exercise for us to be cognitively accessible because acronyms are not cognitively accessible and we often use acronyms. In fact, that's an instinct for us to abbreviate, complex terms into acronyms. So we always make sure, especially when working with persons with cognitive disabilities, that the terms should be expanded into what it stands for rather than turn into acronyms. So Virginie has talked a little bit about how informed consent should be conceptualized. It is a human right. It should also be conceptualized as an ongoing process. So not just a static, one-time signing of a consent form doesn't necessarily mean that you have obtained informed consent, although that is an essential part of obtaining informed consent. So research participation is complex and is multifaceted, and it often puts people in new and uncomfortable situations. So understanding the individual's needs or the person's needs that you're working with is critical. Having meetings with participants or potential participants before obtaining consent can offer many advantages. It can help to understand individual needs and tailor the way you provide information and communicate with that person. Also, you have an opportunity to establish a sense of safety and respect, which will lead to building trust as the research participation continues. It will lead to sort of that relationship building that we had talked about earlier. You can also use this as a chance to ask about their support needs, during their research involvement with you. It's recommended that researchers conduct an initial interview with comprehension questions after you've explained information about the study. So you've done a meeting or a couple of meetings to provide information about the study, and then it's important to ask comprehension questions to gauge their understanding of that information. We cannot assume consent at any point during the research process. You can reach out to us for more details on this, but if there are signs of dissent or it seems like they don't want to participate, there is a process to follow. Just because you have a signed consent form doesn't mean they have to complete their entire research participation if they're uncomfortable. Here's an example of a common question that's asked on Research Ethics Board's applications that some of you may have also completed. So does the project involve minors or individuals who may lack the capacity, for example, developmental or medical condition, to decide for themselves whether to participate in the project? In such cases, both third-party consent and participant appropriate assent are generally required. So below is sort of a typical response that we would provide. We usually say third-party consent or parental consent is not applicable and will not be obtained. Instead, a modified and accessible consent procedure will be used with participants with, this study was with participant with an intellectual disability, but generally with a cognitive disability, based on cognitive accessibility guidelines, in which accessible, easy read language will be used in the recruitment letter, consent form, and during interviews. And comprehension questions will be embedded throughout participation, including in the consent interview, to ensure that consent is ongoing and the participants have comprehension of questions. In an interview with potential participants where you're providing information and it's time to ask comprehension questions to sort of get a sense of, do they understand what the study is about and what their participation involves? Some of the questions that you can ask are, do you have to answer every question that I ask you? What will I ask you about? Who gets to choose if you answer these questions? And can you stop answering the questions at any time? These are essential components that we include in a consent form typically. So we must also keep cognitive accessibility in mind during this informed consent process. And it can actually support comprehension of research information or the study information that you're providing. Because research information is often complex, but if provided in accessible language, and if that process is facilitated, and we can ascertain that potential participants have understanding of that material, then we can be sure that we have obtained informed consent. So the first piece of that is doing those pre-research meetings and doing an interview to support comprehension and ask questions. It's also important to provide the option of having a support person. That could be a family member, a friend, a support worker, like a formal caregiver. So they can have that option, but also know that they don't need to have someone. That person is just there to facilitate communication, not make any decisions for that person, especially if there's no substitute decision maker involved and that person is providing consent for themselves. So that's important to consider. And then accessible language in the consent form. That involves using short, clear sentences, not having any visual clutter in the consent form, and only including the necessary pieces of information. I'll show you a brief example of the way we adapt consent forms when working with persons with cognitive disabilities. And in relation to that is adapted communication methods. So as we discussed before, slowing down your pace and speaking at an appropriate pace and timing with the person that you're interacting with. That's important as well. And speaking in the language that they're familiar with. There can be diverse communication needs. Your participants may be verbal or nonverbal, but their communication profile should not exclude them from your research study or parts of your research study. Instead, us as researchers should make efforts to provide the accommodations needed so that they can provide their valuable expertise of lived experience by participating in that research. So here's an example of consent form. This is actually a consent form I used for one of my thesis studies, which concerns parents with intellectual disabilities who are involved in child protection, which is a very sensitive topic. So I had to be very careful with this consent form. So at the top here, we have the option to hear the information about the study instead of reading it. So this is, if there are literacy issues, or even if there are not literacy issues, this can be an option because some people may prefer having information read to them. We also typically include our pictures so that they immediately have a visual of who the people are who are inviting them to be part of the research. We use short and clear sentences, limit visual clutter, only express one idea per sentence, and there's a lot of white space, so it's easy to read. We also use plain language to explain complex words like voluntary participation. So it is possible to include all of the necessary or legally required components of a consent form in accessible language. And lastly, empowering them by letting them know their rights in language that they can understand, and just including necessary phone numbers, nothing extra. And that's all